Hi, everyone. Welcome back to Medical Mondays. If you all are new here, hi, I'm Dr. Jenny Lay. I'm a family medicine physician and a mom of two. So while we are waiting for everybody to come, I thought we'd talk about residency and interview season that is upon us. Um, Coming from residency recently, well, maybe like a year now, I want to give you guys tips on how to stand out as a medical student going through your interviews, some of the questions that they'll possibly ask, and some of the things to look for as a med student, like interviewing at different residencies, and then talk more about family medicine and what is so amazing about family medicine and why you should consider family medicine as your future career. So, as always, leave your questions in the comment section or the comment box, and then I will pull up anything that you guys wanted to ask into the screen, and then we'll have like a good question and answer kind of thing. All right. So, um, family medicine, a lot of you are wondering, like, what is actually family medicine? What does that entail? And during your residency, you kind of do a lot of the things that you did during med school, where you go through all the different rotations of different subspecialties and learn directly from them. Except now you are the physician. So you do a lot of the main assessment and plans and come up with everything. Hi, John Ross. So basically, you go through internal medicine, family medicine, dermatology, OB/GYN, all the different, subspecialties, pulmonology, gastroenterology, and you basically work on their service as their resident. And so you will learn so much from all the subspecialties. As family medicine, you don't like you have to understand like the broad picture, but you don't have to know absolutely everything. The important thing is to know what you don't know, right? So for me, I think the best type of doctor is understanding your limitations and knowing when to refer out. Kind of like the quarterback, like you can run and you can do all these things and you know when to pass, but knowing who to pass to and knowing when to do that perfectly is what will make you like a good family medicine physician. So during your residency, I think every residency is different. Some family medicine residencies are more OB focused, some are more inpatient, internal medicine focused. And so you would have to learn that for yourself based on what they provide for you when you're like looking this up, and during your interviews and talking to the residents. And so like I interviewed at a few places in California where it was like solely inpatient based, like they had 8 months out of the year or something like that. Usually it's like your rotations are 6 weeks at a time, and then they would do like 3 rotations in a row or something like that, where it's like all inpatient based. And then usually for ACGME, there is a cap where you're supposed to only see like 8 new patients or 6 new patients or something like that. But when I was an intern, there was no cap. And so I was seeing like 10 to 15 new patients in a day. And then on the weekends, when I was working by myself, I can see up to like 25 patients by myself. And it could be fairly dangerous, like because when you're overworked and you haven't had enough sleep, you tend to miss things. And so there's always an attending there, but it's always scary, right? And so look for those things in your residency. Are the residents overworked? Are they happy? Do they get along with each other? I think that's one of the most important things. If the residents enjoy each other. Every residency is going to be hard, no matter where you go. So remember that. The most important thing is being able to find a supportive network in which everybody gets along and is willing to step up for you, because you're going to have your bad days, and be willing to step up for them. So at the end, I'll talk more about what I personally do in my practice and how how much like breadth of medicine I still practice. But right now we'll give you some tips on how to, how to stand out during your interviews since it is interview season. So usually interviews for residencies is the whole day, kind of like med school interviews, where you go and then you kind of have an orientation where they talk to you a little bit about the program. Usually the program director or something like that will tell you about it. And then they will kind of show you the grounds, which is show you the hospital, show you the inpatient beds, the ER, the outpatient setting, the resident lounge, the cafeteria, and all that stuff. I mean, all those things are nice, right? But it doesn't, like, I would try to talk to the residents as much as possible. There's a section where the kind of like the faculty will interview you, and then there will be another section where the residents interview you. At least for my program, that's how it is, because the attendings would send in a rank list, and then also the residents will send in a rank list, and they kind of match it up to see who we will end up ranking. The interviews with the attendings, they usually go through your application. So it gives you time to explain some of the things that may have gone on. So I want you to think of it this way, like, what can you, instead of saying like, you should choose me, like, oh, I really want to be here, think of it in a way of like, what can you offer this residency? What can you bring to the table? Specifically in your interest, right? So me specifically, I knew that I wanted to go to a residency that focused on OMT, which is osteopathic manipulative treatment and medicine. And I wanted a longitudinal program, which I continued to, where it enabled me to continue practicing OMT throughout my residency. And so, coming up with ideas of how to incorporate some of those things. Every residency is interested in research. And so if you have no interest in research, at least come up with ideas, because they might ask you like, what potential research topics or ideas can you come up with that is good, thing to start during your residency? I think I had one residency interview asked me about that. And I personally said that I had an interest in both OMT and OB-GYN, or like labor and delivery. And so I read research before where when applying osteopathic manipulative treatment to patients in labor, not only decrease their pain, they use less medications, but it also shortened labor. And so that was my proposed topic, and they were fairly impressed about that. And so always think about what you can offer and bring to the table, and think of like, what does this residency want, right? What is it that they want that I can potentially provide? And you would actually have to do a lot of research, prepare in order to get that. Another thing that they will actually ask you some scenarios for the interview. What was my scenario? It's just like, okay, a patient comes in and he complains of what is it? Polyuria. What is it? What are some of the things that you think about, and what are some of the things that you can do in the clinic as a workup for this patient? And so you kind of have to think on the spot. So basically, polyuria is like, this person is peeing a lot. You think of diabetes that has not been diagnosed. So what are the things that you can do in the clinic is like a finger stick glucose, right? Or a UA or something like that, but usually finger stick glucose. So it's hard to say what kind of scenario that they will ask you, but it's like really random, I think. I think my internal medicine friends were asked like medical questions as well, but I forget what they were asked. And then during your interviews with the residents, we usually ask you about your hobbies. What do you like to do in your spare time? And what are your ties to the area? We're looking for somebody who is going to fit in as like a family member, right? Because as I said, residency is going to be hard, 3, 5+ years, and you want to get along with the people you're working with. And so if you don't get along with one of your co-residents, it's going to suck. Like the whole years, 3 years are going to suck. And luckily, like everyone that was a part of my program, like I love dearly and I still talk to this day. And I only have good memories to think about when I think about them. But showing that you are a team player, that you don't know everything, but you are willing to learn and figure out those things on your own. And so things that would kind of throw me off when people would ask are like, you know, how many days off do you have? Or, I mean, I guess it's like, it's nice to know, but those things like you can figure out in the pamphlet, right? The residency program will tell you like, these are how many rotations you have. These are how many vacation days you have. This is your call schedule is like. I asked more about like, does anybody in the residency have families? And has anyone started or expanded their family during residency? So you kind of get to know the culture of the residency and what they feel about certain beliefs. Because for me, if you guys have followed me for a long time, know that I was pregnant my 4th year of med school, and then once again during my 2nd year of residency. And so it was important for me to have like my kids while in medical training. And I wanted a program that was going to support me on that. I wanted a program that was going to support me with breastfeeding and continuing to breastfeed at least for a year. And so figuring those things out and communicating effectively, as as much as they are interviewing you for a spot in their residency program, you are also interviewing them. So make sure that it's a good fit. But yeah, let's see. So family medicine is an amazing, amazing subspecialty. In family medicine, specifically in my clinic, I do a lot of mental health, psychiatry stuff with depression, anxiety, a lot of bipolar. Schizophrenia is a little bit harder for me. And so, like, I try to refer a lot of my patients to get them connected with psychiatry and counseling. But if you guys know or have been in medicine, those things are very, very difficult to come around. So I try my best to be that bridge and provide care where I can. I also do a lot of procedures. And so on a regular day in clinic, I can do cryosurgery, which is just like liquid nitrogen, that gun where you freeze off precancerous or cancerous lesions. I do skin biopsies, from punch to excisional biopsies. I've cut out several cancers before, and I have gone back and taken out margins before. I do lacerations repairs. I do colposcopies, which is like, when you do a pap smear, you look at the cervix, and sometimes when there's abnormal cells, I go in and I take biopsies of those. I do joint injections, knees, shoulders, elbows. I do trigger point injections. So those are more into the muscles. I do lots and lots of OMT. I used to deliver babies when I was in residency. And at one point in time, I thought I was going to do a fellowship and do a high risk OB fellowship. But then I realized that I didn't like cesarean sections that much. I didn't really enjoy them. And so I decided not to. I wanted to focus more on my schedule and a work-life balance and more predictability, and just, developing that relationship with my patients. What else do I do? Sometimes I would inject keloids, but that is more of like a cosmetic thing. And you have to be very precise when injecting keloids, because if you inject the fat underneath, it can melt the fat and then you kind of still have the keloid, but it will just be sunken down into the skin. So it doesn't really look as nice. So I don't tend to do those as much unless someone's just like, no, I rather prefer you do it. But yeah, I do a lot of skin biopsy stuff because also it's very hard to get into dermatology. What else? But yeah, those are the ones that I can think about so far. I think my clinic is super exciting. Oh, and IUDs, Nexplanons, I do all that stuff too. So yeah. Let's see. I'm going to go through some questions that you may have. So let's put it in here. So I think this is a good question. Most common questions and tips of what you should include in your answers. I think that the residencies will always ask you if you have any more questions, right? And I think that you should always have more questions, right? But in the moment, you're like, oh, what am I going to ask? And so I think a very impressive question or answer, specifically directed towards like the medical director or something like that, is ask about what are some of the limitations of this program and what are some steps that they are looking to amend those, limitations, and what type of resident are they looking for, and how can a resident improve if they are not meeting these recommendations, kind of thing. So not only are you, this shows that you're interested in finding out some of the difficulties of the program, but also how to make the program better. Right. So then if you're addressing this towards a resident, you can also ask them, um, what are some of the limitations, right? What are some of the difficulties of the program? And how do you think like they can make it better or something like that along those lines? I think that showing that you're interested in improving the program and helping to make it better is a good attribute to display, like at the same time, like, being a team player and all that stuff. Okay. Okay, another question. Post-interview communication with the programs, what should we do? So, after interviews, we all meet up and talk about the interviewees. Oh, there's also a lunch or a dinner or something like that. So, usually with your interviews, at the end of it all, we invite you to dinner usually. And I highly recommend that you go to this dinner and be on your best behavior. Um, because, and the reason, like, watch the people around you. If they are ordering drinks, then maybe you can order drinks. Um, just be kind to everyone, be courteous, be kind to the people serving you, and all that stuff, because they are watching you. They are watching how you are even after this interview process. And so had people we put on like the red, like absolutely not, because they treated the waitress poorly. Like, we don't want to work with someone like that. You show your true colors by the way you act towards this waitress. And so yeah, so be on your best behavior. The interview continues the whole time. I would say after the interview, if you really, 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 really like the program, email them email the chief, find the chief resident, get their email along with the program director, and get their email, and then just email at the end and say thank you for the interview and how you really enjoyed it, and just be honest. And then usually by the end of ranking, you can also like send another email and be like, I really enjoyed your program. I personally emailed my number one choice program and told them, I really enjoyed your program. I know I was the first to interview there and audition there, but you are my number one choice, and I will be ranking you number one. I was just like very honest, but do not do that with multiple programs because the program directors talk to each other. So I did that and I matched my number one choice. So keep in contact because we do talk with each other and we do mention, but don't be obnoxious about it because people in residency are also very busy. So, have you ever delegated your patients during residency? If so, has it gotten you in trouble? So, during inpatient, the goal is to not only take care of your patients, but as a resident, you're also learning how to be a teacher. And so at the end of the day, your notes have to come from you. But if you have a med student under your wing, the only way to learn things is if you actually allow other people to do the work. And I think that's why I was struggling so much in my second year, because I had interns under me in which I had to like loosen the reins enough for them to, do it on their own. Um, but whenever I saw anybody struggling, I kind of like swooped in and was just like, oh, let me help you and let me do that all for you. And in my head, like I thought I was helping, but I was actually doing them a disservice because by doing the work for them, they're not really learning. And even though it like made me feel uncomfortable for things to be like done wrong, or not done wrong, but like a different path, or like not how I would have done it, and the process take longer, you have to sit with that uncomfortability and allow your students to learn that on their own, and then give correction and kind of give advice when it comes. And so as a resident, you will be delegating your patients to other people, but you are ultimately the person responsible for your patients at the end. So at the end of the day, say our patient list, if I'm the senior resident and my intern, I have two interns, they both have 10 patients each to take care of. I have to be responsible for all 20, make sure that everything is right with all 20, but the two interns will be doing like all the notes, and I have to read them over and make sure that all the plan is correctly done. And so yeah, what I'm trying to say is you will delegate. When you're an intern, there's really no one to delegate to, like maybe a med student, but they are not able to do much, right? A med student can go get your history for you, but you will actually still have to get your history yourself. And you can teach the med student how to do like a good history physical exam and teach them how to do a good oral presentation. But at the end of the day, all the work has to go down to you. Like you will have to still finish all your notes. So yeah, there's really no one to delegate your patients to. Like even as a doctor, at the end of the day, you're responsible for all the notes. You're responsible for seeing the patients. There's really nowhere to run and nowhere to hide. Um, uh, Oh yes. Oh, I forgot that. It's COVID. And so there's no dinners for any interviews now, and it's all virtual. Oh gosh, I forgot. Um yeah, we're not meeting together. I'm hoping that would change soon, probably not this year, but I think it will soon. Virtually, I'm not sure how we're going to do that virtually. Maybe there's going to be like a Zoom hangout session, but it's like really different when it's online, right? Um, Super different. Okay. Did you ever experience sexism during residency? Any stories that stand out you're comfortable sharing and how to deal with it? Um, I think I was very lucky in my residency because I had strong female influences, especially. My chief resident was a female, and she also became pregnant during our residency training. And we were huge advocates for, moms in medicines and, expanding your family. But we did talk a lot about discrepancies and minorities in medicine and how we experience a lot of microaggression. Like when people say like, oh, you must really miss your children, like who is watching your children when you're in residency? My husband is watching them, or they're at daycare, or a nanny. And they never ask this of our male colleagues. No one ever asks, like, do you ever miss your children? Like, of course I miss my children. I miss them all the damn time. But the difference is because I'm a female and I should be somewhere else, is just like a hard pill to swallow sometimes. But I just advocated for myself because I felt like I not only had to take off pump brakes, but I felt like I had to work at an extra level to be better than everybody else because I'm taking this extra time to feed my child, right? But breastfeeding is like a necessity. Like you can't just not pump throughout the day because then you'll get mastitis. It's like telling somebody to not pee, like, oh, just hold it in. You can wait a few hours. I was like, no, you can't. You can't. There are medical things that can occur, so other than that, like I think other programs may have it more, but we just had a really good culture in our program. I think I get a lot more sexism from my patients because I look very young and I'm very small, like a small Asian female come into their room. And I've had a lot of patients just think that I was a nurse or that I was a tech, that I was a lab person, anything but their doctor because I was kind. And, at the end of it, if I was really nice, they start calling me sweetie. I think that's the one that gets me the most. Like when they call me sweetie or honey, I'm just like, oh, don't call me that. Like, I really hate it. Like, I hate it when, like, old, even I've had this young, like 30 something, like 36-year-old guy call me sweetie. And I was like, oh, like it's so horrible. I really hate it. And like usually I just smile, but I should really stand up for myself and say something about it, and say, actually, I'm your doctor. But I don't, because most days I'm just too tired and don't have enough energy for confrontation, especially during COVID. But I really should. And so I used to not even correct people when they say my name incorrectly. Like my last name, a lot of people get it wrong, but my last name is Lei, like it's L-E. And a lot of people call me Jenny Lee, L-E-E. And it's a very common mistake, and it's totally fine. When I was younger, and if you ask a lot of the Vietnamese community, like they're all like, oh yeah, in English it's Lee, but in Vietnamese it's Lei. And I don't know why, for some reason I started residency and I wanted people to start calling me Lay, even though all my life people were calling me Lee. And even sometimes I would catch myself and I would say Lee. But right after I would say something like, "Oh, hi, I'm Dr. Lay." They would say, "Oh, hi, Dr. Lee," or even at the end, like, "Thank you, Dr. Lee." And it just, yeah, I don't know. And so it's like a respect kind of thing. But yeah, this is a hard topic. I think the more that we as attendings or people in power, as you would say, stand up for ourselves and stand up for what is right, equality, it makes it easier for people like medical students and residents to, be themselves, and be treated equally, because it's harder as a med student to fight against those in power. And so I think that as an attending, I need to be more vocal about it for the sake of the future med students coming. That was a very long-winded answer. Okay. Do you have any tips for virtual interview? Is it okay to use a laptop camera with headphones and lights are best? I think on your laptop is fine. Stay somewhere that has. I use this microphone. I don't know if you guys can see it, and I don't know how the audio is translating over on the other side, but it's very cheap. It is from Amazon. I think it was like $12, and you just click it into your laptop. I think the better audio quality is probably better than the video quality, to be honest. But at the end of the day, like, I don't think anybody is worrying much about that. A lot of people in residency are also very low tech. And so I have a special interest in YouTube and filmmaking and all that stuff. And that's why I have all this equipment, but it's absolutely not necessary. Be yourself. You can possibly like not even wear any pants and still be fine. Just wear a nice blouse or button up and be professional from up here, and be courteous, demand respect from the other people. Like when you're interviewing someone, you want them to know that, like, they're respectful of your time, they're courteous, they're interested in what you have to say. And so, like, I wouldn't be like lounging back and, being nonchalant about things. So I'll still be on my very best behavior. I think it's a lot more like tiring when you're on Zoom, because like you don't get to read a lot of social cues from people. Like, you can't read body language. And so you always have to be like very uptight. And so it's more about what you say and what you bring to the table. Don't worry too much about the camera and all that stuff. If you wanted to be fancy, you can put up like a little sign on the back and say like, "I'm interested in da 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 da." But I think it's also like a speaking point, right? So if you have like things in your background that kind of display who you are as a person, might be a talking point. Like, for other residents, if you're really interested in Star Wars or something like that, or like, like a really unique niche poster in the background, if you wanted to talk about it, then you can place it strategically there. But I wouldn't worry too much about it. This question, should I do EMT before completing my bachelor's for medical school? I think that if you enjoy it, I think that EMT work is very enlightening. You will learn so much about medicine as an EMT, and then you'll probably be inspired to become an ER physician, to be honest. But I think it's a good idea because it allows you to like view medicine and experience it before actually going into the field. It's so crazy that a lot of people go into medicine without actually even knowing what medicine is all about. I know that medicine, it comes from a place of privilege. And so if you haven't had that privilege, it's hard to enter that world and understand everything. Like, I went into medicine not knowing if I would truly love it or not because I didn't experience it enough. I went through like some clinical career extenders, CCE, and volunteered at hospitals and nursing homes, and ultimately shadowed a physician that inspired me to go into medicine. But I did not truly know everything about medicine before I like entered it. So I always tell people, shadow as much people as you can, cold call, email clinics, in order to try to get in. I know there's social media platforms that they host like virtual sessions where they shadow doctors virtually, and you just sit silently and listen in on their day and when they talk to patients and stuff like that. So I think that now that's a lot more readily available given the pandemic, but just experiencing it as much as you can. If you're a great typer, if you can spell, then you should try to be a scribe. Not only does it pay you, it gives you clinical experience. It lets you work directly one-on-one with a doctor, so you know their thought process of differential diagnosis, what to look for, what to ask, their schedules. So not only do you get to see what it's going to be like as a doctor, the kind of schedules they have, the kind of work-life balance they have, but you also see like medicine. And so once you start medical school, if that's what you want to do, you're going to be ahead up of the game because you know the medical lingo, you know all the different medications that are being tossed around. I knew nothing about medicine. And so pharmacology was so hard for me, like just memorizing like metoprolol, propranolol, azithromycin, like learning the different names of drugs was so like a foreign language to me. I'm an ESL student, like English second language. I was born in the United States, but my parents grew up speaking to me in Vietnamese, and I didn't speak English until like grade school. Long story. Anyways, and so I still have a list. I still have a lot of difficulties like reading. I do not as great on standardized testing because my English is so bad, and just reading questions over and over. It gets better the more I read, but yeah, so that's my recommendation on people who are interested in medicine. Exposure. Let's see. How have you known someone who works as a CNA become a doctor? I have not personally known anyone who worked as a CNA and became a doctor. I do know about nurses who have become doctors. There were several in my class. I know PAs who have decided to go to med school later in their career. Also, one in my class. Um, I know of some doctors who switch specialties, but I don't know any specifically CNAs that have become doctors. I think some CNAs like are more interested in uh, RN, like nursing, because it's a little bit more similar. Like the care that you're providing, nursing and doctoring are two very different things. Um, and so as an RN, you're working a lot more with the patient and you see them on their day to day and some of the changes. But there's difference in doctoring because you need to understand like the whole pathophysiology and understand the plan like further than that, right? It's like RNs, it's like the small picture of something, and then the doctor is the bigger picture of that, but they still two work together. And so most of the CNAs that I've worked with either go on to become RNs or they're just really happy as CNAs. And honestly, we need everyone to be part of the team. So if you're trying to get a stepping stone to medicine, um, I I would say, I don't know. Stepping stone to medicine is medical school, right? So it's a totally different entity. Okay. Do you think residents tend to be honest or they'll try to cover the program's flaws? I don't know personally, but I know for our program, we are all very honest. And so I think that you'll have to try to judge that for yourself. I interviewed at a program and I asked them, what are your flaws for this program? And this resident knew that I personally really liked OMT. And he said that, we do not have a strong OMT program here. It's longitudinal, but you'll work on the skills that you have. But if you're looking to learn more, and if you're looking to better your skills like with new techniques and learn from somebody, then this is probably not the program for you. And I like really appreciated that honesty because I like that program. I like the location and the people there. But like it really fell for my rank list. And I think that's what we're saying, that a program is honestly looking for someone that will match their program at the same time you're looking for a program that matches your needs. So try to be as honest as possible. But I know that can be really scary because this is like the rest of your life, right? I think during my interviews, I didn't even know I was pregnant. uh, During my interviews, I just knew that I was very emotional. But I think that they're not allowed to ask you certain things like about your family, about your religion, about like, do you plan on having kids and all that stuff. And I think that sometimes those are red flags. You can definitely ask them. Like, I asked personally, I was like, does anybody have a family here? Like, does anybody, um, plan to have family here? So definitely, I think that you should definitely ask. And ask multiple. You can ask multiple people if you feel like the person that you talked to you didn't really trust. But that shouldn't like be a red flag too, right? If you feel like you can't trust a program, then I don't know, you shouldn't really want to be there because you will depend on your co-residents a lot. As I said, you will get sick or you will have a baby or, something tragic in your family happens or you just need to get away. And so you want to depend on your colleagues. You want to be able to lean on them and lean on each other. Okay. Anything else that I can answer today? I think this should be like more of this stuff coming up. I don't know what kind of interviews you are going to, but I can think of some things that you can ask. Maybe come up with some questions that you can ask the program. That'd be important to know. But remember, your time's off, your on-call schedule, all those things will be given to you already. So don't ask about them. Ask more about the culture. Ask more about, do the residents hang out together? What do they like to do for fun? Are there any like special events that they like to plan together? And who can they turn to if they are struggling and things like that. So I think that those are really important questions to learn that, are you going to survive residency or not? Like, it just really depends on the people that you're with. Oh, yeah. Are there programs that will treat you poorly if you have a family or kids? Oh, yeah. Yeah. There are programs out there who like look down upon you, who think that, you're taking more time to complete your residency. There's some people think that you'll be taking too many breaks, and very misogynistic culture of medicine. Those are the residency programs that I tend to stay away from. Um, and saying that, you know, you won't be enough because you'll be a mom and all that stuff. Like, yeah, don't be at those programs. Very misogynistic and not something that I would want to endure for the next 3-5+ years. I think, I don't know. Is family medicine a hard residency to match into? I would say it depends. It's one of the, I think it would be one of the easier ones to match into, but there's a 20% chance that you might not match at all based on the last year projections. 20% of medical students who try to match into residencies did not match. Just because there's not enough residencies for the amount of med students. There are new medical schools coming up all the time, but not much residency programs. And so I would say it is a lot easier to match family medicine than other subspecialties like dermatology, radiology, orthopedic surgery, and all those other things that people really want to. But I think that it will be hard for the location that you want. So if you want a particular location, then it just depends. Right? But I think I would say possibly it's easier. Okay. Do you know what that someone has double resident or have all the license in all area? I think you're saying, can someone go to 2 residencies and have license in different areas in the United States? Is this what you're saying? You cannot go to 2 different residencies at the same time. You can possibly transfer. Like, I've had surgical residents transfer to become family medicine residents, and then they complete family medicine residency and then take family medicine boards, but then they would not be board certified as a surgeon. You can have license in multiple states. So I know people who have a virtual practice, like a family medicine virtual practice, and they have medical license in multiple different states so that they can prescribe and give medications to those patients in different states. And that is just application to apply for the license there. It's just expensive to get licensed in multiple states, but you can. So say like I travel to California once in a while, then I would have to get a license there in California to practice. As of right now, I'm only licensed in Washington. So yeah, I guess you can go back and do a different residency and be dually board certified. I mean, usually what people do is they go and they subspecialize, right? So like if you go into internal medicine, you complete 3 years of internal medicine residency, and then you specialize, you do a subspecialty in like say cardiology, which is an additional 3 years. So you're board certified in internal medicine cardiology. And then if you want to subspecialize even further, then maybe you could do 2 more years of interventional cardiology. So like you would be a board certified interventional cardiologist, which is additional years, but you have to go through each residency a year at a time. I hope that makes sense. Okay, lots more questions coming. Probably one more question, and then I'm gonna have to go get lunch. I think this is a good question to end on. Aside from asking great questions, what are other ways you show your enthusiasm and fit for a program on interview day? So I did this for my med school interview, but you know, I smiled a lot because I thought that, and genuinely smile because I thought that no one can really be mad at you if you were smiling. And I felt like when I smiled, I was just in a more pleasant attitude and just getting to know the people around you, having normal conversations, because at the end of the day, you are trying to be friends, or basically like dating, right? This is like speed dating or like a whole day of dating. And you really just want to get to know the person that is across from you. Be genuine. You don't have to have this hyper energy all the time, but be truthful and be honest, and when they ask questions or when they talk to you, like truly listen and think of like getting to know the other person, getting to know the program. I know some people are just not as, outwardly, and more people are like shy and reserved, and that's totally fine. I think just putting it out there and saying like, I know that I'm a very shy person, but I'm very interested in this program. I love X, Y, and Z that you offer. I think that we can be a good fit. I think that X, Y, and Z is what I can provide for this program, and just being honest. And I think that that is a breath of fresh air, at least for me, when I saw residents like that. And as much as it's painful for you, I think that residents also hate small talk. um, like don't try to. One of the turnoffs, I think. So during residency interviews, I had the interviewees come to my house because I had 2 children. It's very hard for me to, bring them out anywhere. And so everyone else was busy. And so I just invited them over to my house. And then I had other co-residents come, and the people, who came were like these 3 buff dudes. And then it was me and other 2 girl residents and our children. And so they were talking to our husbands, and they were talking about how they wanted to climb Everest and all this stuff, and didn't really engage us in the conversation at all, when one of our co-residents used to be like a guide. And so she was just like, yeah, they didn't look at us because they didn't even think that it was possible, because our small frames or whatever, like the same sexism. And so they were X'd off. But, like just truly getting to know somebody without like trying to boast so much about yourself and be like, oh, I have an interest in YouTube. Like in my spare time, I like to make medical videos and like explain medicine for those around me, to provide more access to medicine, because I feel like that's where it's lacking. So saying things like that, and then but not saying like, I have this many subscribers and these viewers and blah blah blah, like I'm hot shit, like more of like, this is what I'm doing, this is some of my passion, like are you interested in this too? And engaging how they are, and like asking like, so what are some of your interests, and what do you do in your spare time, and what are some of the things that you enjoy, and like when the little times that you have during residency, your times off, like what are some of the things that make you laugh? I think that would really catch them off guard maybe, and break down some of those walls. But yeah, so be honest, be truthful, be genuine. Remember, as much as they are interviewing you, you are also interviewing them. So all right, everyone. Hope that this was helpful. Let me know if you guys have any other questions specifically about, residencies and interview season. I know a lot of them are going to come up during the season. Just leave them in the comment section. When you get residency like interviews, you can just let them know like, hey, I have several interviews in this area, and is it possible to interview around the same time? Residencies are usually very accommodating to things like this because they know as residents or as medical students, you don't have a lot of money to be flying to multiple places. And so usually they'll be very accommodating for you. Just be honest with them. It's not going to, I think a lot of people stress out that like they need to respond right away. And I would say like you can respond. Or if you're waiting on an interview, then you can say like, oh, hey, I am interviewing at this place. It's in the area. And I was wondering if you have viewed my application, if I am considered for an interview invite or something like that. Okay, so hope you enjoyed this. Thank you guys all so much for being here. I always love hanging out with you. I love this chill, relaxed vibe. I'm all about it. I recently did a video posted yesterday about PCOS and infertility. So if you guys wanted to watch that, that is up. Let me know about any other medical topics you want to talk about, and then I can make a video on that next. All right. Heart. Peace. Bye.